Hi everyone, I am going to be talking about muscular dystrophy. Muscular dystrophy is a group of diseases that result in progressive weakness due to a loss of muscle mass. Dystrophy is defined as impaired nourishment of a bodily part. So in this disease, that is an impaired nourishment of the muscles. There are over 30 different types of muscular dystrophy. There are 9 that are identified as being most common, but I am going to be focusing on Duchenne muscular dystrophy because that is the most common of all of them. In Duchenne, there is a complete absence of the protein dystrophin, which is primarily found in muscles. So for the cause, it is a mutation on the X chromosome. Duchenne is again caused by the absence of the protein dystrophin, which causes muscle cells to become fragile and to be easily damaged. The method of diagnosis, the first steps in diagnosing muscular dystrophy include a family history and a clinical review of symptoms as well as a physical examination. During the exam, doctors will look for patterns of weakness. For children who have a family history of muscular dystrophy and show signs and symptoms, a diagnosis is pretty straightforward, but doctors will still order tests to confirm. One test that is performed is a blood test to test for elevated levels of creatine kinase. This is an enzyme that leaks out of damaged muscles. So a high level of that creatine kinase shows that muscles are most likely the cause of the weakness. Genetic testing is also performed to look for a mutation in the dystrophin gene, and muscle biopsies can be performed to diagnose Duchenne muscular dystrophy, as well as to distinguish it from other forms of muscular dystrophy like Becker. Becker is just a milder form of the Duchenne muscular dystrophy. In Becker, dystrophin is partially functional in muscles, whereas in Duchenne, there is no functional dystrophin. And it can also, the biopsy can also distinguish from other diagnoses that may mimic the signs and symptoms of Duchenne. So some inflammatory diseases that may have some of the same symptoms. There are several different types, characteristics for Duchenne's. For toddlers, they may be late walkers. Children with Duchenne's will often have large calf muscles, which is termed pseudohypertrophy. This is caused by an abnormal muscle tissue or it could be caused by scar tissue. They may be clumsy and fall frequently. When they reach school age, they may show signs of toe walking, a waddling gait. They may also stick out their stomachs while they walk and pull their shoulders back. And this is to compensate for balance issues. A learning disability is seen in about 1/3 of children with muscular dystrophy, and that includes um, problems with attention, emotional interactions, and memory are the ones that are most commonly seen. The Gower maneuver is what is pictured on the right, and this is a type of maneuver that children will perform to get up off of the floor. And they do it in a way that compensates for their muscle instability. Weakened heart muscles and diaphragm muscles um, are also characteristics of this disease. Decreased respiratory function because of those diaphragm muscles, which also lead to cognitive difficulties due to decreased oxygen supply. So they may have difficulty concentrating, they may get headaches, or may have difficulty staying awake as well. For Duchenne specifically, it's present at birth. Symptoms are observable by the age of 3, and that is because they doctors are seeing delays in motor development, including being able to sit upright. They may have trouble standing, walking, running, going up the stairs. And so those are big red flags for parents and for pediatricians. Involvement begins with the pelvic girdle and progresses to the shoulder girdle, and then followed by the arms, legs, and trunk muscles. Due to the distal muscle involvement, frequent falling begins to occur between the ages of 5 and 6. By age 14, most children are confined to a wheelchair. Cardiac and respiratory muscles are often affected in an individual's early teen years. For statistics about Duchenne, Duchenne and Becker, which is just that milder form of Duchenne, occurs in 1 in every 7,250 males. The reason that it is more commonly seen in males rather than females is that it is on a mutation of the X chromosome. And so for females who are carriers, they have an extra X chromosome that may be typical, and so it compensates for that mutated gene. So according to the CDC, prevalence is higher among Hispanics and non-Hispanic whites as compared to African Americans. The prevalence of Duchenne is 3 times higher than that of Becker. Every male born to a mother with a dystrophin mutation on one of her X chromosomes has a 50% chance of inheriting the gene and having Duchenne. Females born to a mother with the same mutation on one of her X chromosomes has a 50% chance of inheriting the mutated gene and being a carrier. While it is most commonly inherited from a family member, muscular dystrophy can occur in children with no family history. So there is no cure for this, but medications and therapies may help in prolonging life and quality of life. So for some therapies that are researched, range of motion exercises are aimed to keep joints as flexible as possible. Some exercises that can be done are low impact aerobic exercises, so walking, swimming, things like that are good for patients. Braces to prevent contractures are good. These will help keep muscles and tendons stretched and flexible for longer. Mobility aids, so a wheelchair, cane, walker, as appropriate for the patient. And respiratory care and assistance. Like I said, we have patients who are affected by the diaphragm weakness. So some breathing aids. A lot of patients will wear a breathing mask at night, like the mask worn for sleep apnea, to help with that quality of sleep. In an article published in 2016, some strategies to target respiratory difficulties were discussed. Monitoring for inadequate respiratory capacity is important to target effective immediate treatment. And those included some chest physical therapy for airway clearance and that face mask while sleeping. For medications, The first medication to be approved by the FDA to treat Duchenne was approved conditionally in 2016, and that is Emflaza. And so there is no data to support its effectiveness, but it is scheduled to be evaluated at the end of 2 years. So I think this year it will be looked at, and hopefully it has been effective. Some corticosteroids, such as prednisone, are used with most patients, and heart medications. So for those patients who have cardiac involvement, things like beta blockers are used to treat those. And I couldn't really find success rates on medications, but it did say that most patients who follow these therapies and medications do have a longer lifespan as well as a higher quality of life due to being able to be active for longer and being able to participate in daily activities. So for prognosis, if left untreated, individuals who have muscular dystrophy will likely only survive into their teens. However, there have been a lot of respiratory and cardiac advances, different medications that have come about, and individuals are surviving much longer today, usually until their 30s, but there have been cases of individuals surviving into their 40s and 50s as well. And so with appropriate therapies and medications, individuals with muscular dystrophy will have a higher quality of life. Like I said, they're able to participate in their daily life for longer, being able to be mobile for longer. So they are having that higher quality of life thanks to all of the advances. And that is it. Thank y'all.